So, you want to learn about the mentally ill within prison, huh? Well, that'll be easy, because the rates make up anywhere between 25 to 75% of incarcerated, depending on where you look. The thing is, most of these inmates do not stay in jail or prison forever. Studies show that there is little care provided to these inmates to get them reacclimated to society once they are released. It's time someone starts to care, because these people could be your neighbors, your family members, or even your public transportation buddies.
Close your eyes and imagine yourself locked in a room that is half the size of the room you live in right now. Imagine dusty floors, an open toilet, only a thin blanket to cover yourself while it is below 50 at night, and showers shared with hundreds of people. Okay, now imagine yourself with a mental disorder that prevents you from living your life to the full capacity because you need extra assistance with care, which is nowhere to be found. Sounds fun, right? Wrong. There are thousands of mentally ill offenders who require medications and special aid. But who needs daily medications in order to function properly these days, right? That's so last year. Except it really isn't. The mentally ill incarcerated rates are only going up from here. Despite the fact that these mentally ill offenders act out violently, there are still people suffering from disorders that they cannot escape. This clip from Silence of the Lambs is possibly the most well-known example that can come to mind for anybody. Hannibal Lecter with APD, also known as antisocial personality disorder, characterizes violent behavior, which explains the mask and levels of restriction that officers have on him.
The history of the mentally ill is not a positive experience. Mentally ill were treated as if they weren't human, and procedures such as trephination and lobotomy, both in which procedures have a hole drilled into one's skull to cure them of illness. Ouch. Around the 1950s is when it lost popularity. Only took thousands of years for them to realize it was morally wrong, right? We used to incapacitate the mentally ill in psychiatric hospitals for the rest of their lives, but we did away with that with institutionalization during this time as well. Now we incapacitate them in prisons instead. Great solution, guys.
One would typically think that criminals who suffer from mental disorders would receive lenient punishment based on their actions. Although this is sometimes the case, mentally ill offenders are more found in prisons and in jails rather than psychiatric hospitals. This has been an issue since the early 19th century, where those who were described as mentally ill were harshly discriminated. These offenders were described as inhumane and uncivilized, which allowed for them to be easily thrown into prisons. When the first mental hospital opened in Massachusetts in the year 1833, the majority of the mentally ill people incarcerated were picked up and just thrown into the hospital without questioning. Like anything. Nevertheless, today we have a shocking amount of mentally ill offenders locked in prisons, despite the lack of care they are willing or able to give to those in need of that extra attention. So those pretty empty hospitals are just for design so the government could run away from this problem while people suffer behind prison gates. We love our Congress. This next video is a story time. A man with schizophrenia kills his mother, explains his sentencing multiple times, and is let out of prison to go to mental hospital. This clip shows the importance behind making sure we know who is mentally ill and who needs help and who doesn't. Would you feel comfortable being this man's neighbor?
The problem that we face nowadays is how we view the prison systems. Television these days has been romanticizing life behind bars as well as wrongly depicting prison life and the challenges that inmates face in prison.
The biggest problems do not fall into the category of how we treat mentally ill offenders, but it is how we find them. There are many people in prison who are mentally ill and need that extent of attention in order to get better. Although there have been many reformations on how to treat and find them, mentally ill prisoners only have potential to get worse if they are not found and treated for. When we say things are, sick, this is not what we're referring to. They're actually sick. These individuals are really only getting worse than better, which is not what we want to happen, I hope. Ruben Rivera, with many psychological disorders, depicts the main problems discussed. He often faces medical neglection, which causes him to feel more unhealthy than he already does, and places him in an unstable state that calls for passive aggression along with confusion. Thanks to our prisons, this is how he turns out. This next clip is a perfect depiction of how mentally ill offenders are treated in prisons. They must continue their daily routines just with restrictive tools such as chains to hold them back from doing something outrageous. But they're treated like animals. Why would an animal act normal with chains on their hands?
One of the therapy methods used in some prisons, outside the US for my research, is the use of what is called art brute therapy. This type of therapy is used to help mentally ill express their feelings when they may not know how to verbally express them. 2 groups of 60 people were gathered, and for roughly an hour, the inmates are asked to draw anything that has impressed or inspired them in life, including animals, colors, dreams, and certainly not limited in any way. After 16 weeks, the inmates were reported to be less angry, have greater group socialization, and lower rates of anxiety. So how about it? Do you think that drawing a couple of pictures a few times a week is going to cure our mental health problems within prisons?
Solutions to these problems? Simple. The nation needs a stronger system where those who are mentally ill are separated from true criminals who seek evil. This means extra attention for those in need, which our government usually does a great job of, right? As seen with homelessness statistics. Mentally health courts must make more effort for finding justice rather than punishment by making prescriptions accurate and accessible along with therapy.
Every 60 days, 103 inmates with mental health issues are released from prisons, in which 45 of them return to prison within a 6-month span. This is largely in part to prison systems not giving the proper treatment to those who have mental health issues. Clearly, we're doing a great job at rehabilitating inmates, since nearly half of them return to prison in such a short amount of time. Problem? I think not. Looking at women with mental illness in jail, which makes up roughly about 34% of the mentally ill inmates, it was reported that only half of them received any sort of care for their illness. I guess even incarcerated women still need to fight for their rights of equality. Moving on to the federal prisons, Hauser states that 73% of women have some type of mental disorder. Many of these disorders stem from prior abuse such as domestic disputes, rape, or other physical altercations.
All in all, in order to achieve a stable and fair criminal justice system, we as people must seek reformation until treatment is accurate and serves justice. Many mentally ill offenders do not have intent to harm, but is this their fault? That is a question that determines whether they are cared for in a psychiatric hospital or thrown into a lonesome cell that creates bigger problems for themselves and increasing recidivism chances. But then again, who doesn't love a bunch of serial killers running around, especially during spooky season?